Thompson, Cancer Prevention Programs Manager at Nevada Cancer Coalition. More people are diagnosed with skin cancer each year in the United States than all other cancers combined. In fact, 1 in every 5 of us will develop some type of skin cancer by the age of 70. Fortunately, most of these skin cancers are treatable and curable if found early. May is Skin Cancer Awareness and Prevention Month, and today we're talking with Dr. Whitney Hovenic. Dr. Hovenic is a board-certified dermatologist and one of only 4 fellowship-trained Mohs surgeons in Northern Nevada. She is founding member of and president of the Nevada Society for Dermatology and Dermatologic Surgery. Dr. Hovenic practices at the Skin Cancer and Dermatology Institute in Reno. Thank you for being with us today, Dr. Hovenic.
Thank you, Christine, for having me.
Some recent statistics show that more than 2 people die of skin cancer every hour of every day. But with most skin cancers, if they are found early, they are treatable and curable. What are the most common types of skin cancer?
There are a multitude of different types of skin cancers, but the most common types of skin cancers that are also the most treatable are called basal cell carcinoma. And they don't come from the basal plant. They come from the base of the epidermis of your skin, which is the outer portion. And there are millions of these diagnosed every year. They occur mostly on sun-exposed places, and they occur primarily due to damage received before you're 18. And when they're diagnosed, there's multiple ways that you can treat them, but if they are treated early, they're very curable.
And what's another common type of skin cancer?
So going to the second most common type of skin cancer is the squamous cell carcinoma, which also comes from chronic sun exposure. These are the ones we really see if you spend a lot of time in your life out in the sun. But we also see these commonly, very commonly in people who are on any kind of immunosuppressive medication. We see these in a very high number in people who have had a transplant, kidney transplants, heart transplants. People who have underlying medical conditions such as lymphoma or leukemia are also at a higher risk for this type of skin cancer. And these are also easily treated if you catch them early, but if you don't treat them, especially if you have underlying medical conditions that are affecting your immune system, they do have the potential to metastasize to other places in the body, which is where they really can cause problems.
And tell us about melanoma, which I understand is the deadliest type of skin cancer.
Yes, melanoma comes in many shapes and forms. Melanoma, unfortunately, if it's not caught early, can be fatal, but there have been many advances in the treatment of melanoma in the past 10 years. It used to be that if you had an advanced melanoma, it really was a death sentence, but because of advances in drugs that help to fight metastatic disease, more and more people are surviving melanoma. But it's also one of those cancers where if we catch it early, and it hasn't spread beyond the skin, it's much more treatable than if it has already metastasized. And melanoma is typically thought of as a dark brown lesion. There's been a great public health campaign, the ABCDEs of melanoma, that help you recognize lesions that are suspicious due to they have area bigger than a pencil, irregular borders, changes in color, and then they're evolving. So moles that are changing should be brought to your dermatologist's attention. But melanoma can actually look like anything. It can look like a cyst. It can look like another form of skin cancer, a basal cell or a squamous cell. So new lesions really do require a biopsy and a visit with your healthcare provider.
What are some other signs of skin cancer, maybe the more common basal cell and squamous cell, that people should know about so they can check their own skin?
Most of the time, these other forms of skin cancer start as sores that don't heal. So it looks like a pimple oftentimes that doesn't go away. So pimples should be gone in, a week, 2 weeks. Basal cells and squamous cells both can look like that when they start. They can be red, irritated, itchy, and then they don't go away, and they're in the same spot, and they can crust and bleed. Sometimes they have a scaly texture to them. They feel rough with your finger. But if the biggest indicator is a sore that doesn't go away, something that, especially for men, they're shaving over this area, and every time they shave it, it bleeds on the facial area. something that bleeds with very little trauma. So if you get out of the shower and you notice every time you get out of the shower, your nose is bleeding in the same spot, that's a very good sign that there's something there that's abnormal that needs to be looked at.
So how soon should someone see a dermatologist or another healthcare provider? Um, and how regularly should someone be checking their skin?
That's a good question. That really depends on how, if you have a history of skin cancer. I don't want people feeling like they have to run to the dermatologist every time there is something new on their skin. But, if you've noticed that you have a new lesion and, generally 4 to 6 weeks later, it's still there, then it would warrant attention and trying to get in to see somebody, either your primary care dermatologist to have an evaluation or get a referral to dermatology. With a new pigmented lesion, so something dark on the skin, especially something that doesn't have any texture to it and that seems to be expanding or changing colors, that's something we'd like to take a look at as soon as we can. And oftentimes, if you can't get into dermatology right away, really make sure you get into your primary care provider so that they can take a look at it and then make the appropriate referral.